Good morning, everyone. We will go ahead and get started. Happy Friday. I am thrilled that so many people were able to join us for this very important webinar. I'm Ashley Watts. I'm President and CEO of the Kentucky Chamber of Commerce, and I'm going to give you a little bit of background of why we're hosting this webinar and then turn it over to our moderator for the day. As we all know, over the last couple of weeks, I think many of us thought we were kind of out of it when it comes to COVID-19, and we had turned that corner. And then, of course, the Delta variant came back into the picture a couple weeks ago. And as of yesterday, our positivity rate here in Kentucky is nearing 13%. And one of the really scary things about that is over a quarter of those positive cases are children under the age of 18. And so these discussions are happening again about masking and masking in schools and social distancing and whether we have events or not. And one of the main things we here at the Chamber have been really trying to talk through with employers is how to talk to your employees about getting vaccinated. We have been hearing a lot in the last couple of weeks that government has done everything I think that they can to get people vaccinated, including raffles of $1 million. I know this weekend, for example, at the state fair, if you get your vaccine, you're able to ride rides for free at the state fair. And both employers, both public and private, have been really creative in trying to encourage their employees and all citizens here in Kentucky to get vaccinated. We have 3 highly effective, highly safe vaccines that have been created, and we're just trying to encourage everyone to get vaccinated as soon as possible because we really know that is the way that we are going to get out of this. And so we've been talking to employers about talking to their employees about getting vaccinated. And as you all know, employers over the last couple of weeks, many in the healthcare field, have had to make some pretty tough decisions on whether to have their employees mandate they be vaccinated to show up to work. And these discussions are going to continue to happen. And we at the Chamber want to make sure that we are helping you navigate all of these discussions. But the common theme that came up when we were talking to employers was kind of the debunking the myths that many of their employees had been seeing on the internet and on Facebook. And so how do they answer those questions when employees have seen maybe some false narratives about vaccines or things that have just been proven scientifically to not be true? And so we thought we would host this webinar basically debunking all of these myths that we've heard about. And I know when we're talking about this, it's not going to mean as much coming from me or from someone else in government. We really wanted to hear from doctors, from medical professionals who have practiced their career in epidemiology, who know about vaccines, and can really give us some very sound scientific advice on vaccines. So this webinar, we're going to go for about an hour and a half, maybe a little shorter if all the questions get answered. But we really encourage you as chamber participants, as chamber members, to share this webinar with your family, with your friends, with your employees. This is going to be recorded, and we will send this recording out afterward because I know sometimes 10:30 on a Friday morning may not work for everyone to watch it live. And so we will record this webinar, and we are just asking that you share it with anyone who still needs some questions answered about the vaccines, because I know a lot of information is going on out there, and I think it's really time that we have some clear, concise answers on the safety of the vaccines and why it's so important, especially right now as cases are rising, that we all get vaccinated and make sure that our workplaces and all of our Kentuckians remain safe. So to help me today is we asked Dr. Donna Arnett, who is a friend of mine. She is an epidemiologist to moderate this discussion. Donna is the Dean and Norton Healthcare Professor of Epidemiology at the University of Kentucky's College of Public Health. She is also the past president of the National Heart Association. So I'm going to turn it over to Donna to introduce the rest of our panel and our guests, and we'll get the conversation started. Thank you again, all of you all, for joining us, and we hope this information is helpful to you and your employees. So Donna, I will turn it over to you.
Thank you, Ashley, and also thank the Kentucky Chamber for addressing this really critical, important topic and a critically important period in our history. So we have some great speakers today, and I'm going to introduce them, and then we're going to launch right into questions. So our first guest speaker is Dr. Fadi Al-Akras, who's the Medical Director of Infectious Disease and Infection Prevention at Pikeville Medical Center. And he has a longstanding interest in infectious disease research, including COVID vaccines. And he's been really the face of the spokesperson with the media for Pikeville Medical Center. And interesting tidbit about Dr. Al-Akras, he was elected the Citizen of the Year by the Southeast Kentucky Chamber of Commerce in 2020 for all of his tremendous work in this space. We also have Dr. James Border. He is the Chief Medical Officer of Baptist Health, and he served in that role since 2015. He trained at the University of Kentucky, and he's currently the president of the Lexington Medical Society. And this year's primary emphasis of the society is clearly combating COVID vaccine hesitancy. We also have Dr. Stephen Hester, who is the division president, provider of operations and system chief medical officer for Norton Healthcare. He is a U of L graduate and received his MBA degree from Bellarmine University. And then finally, but not least, we have Dr. Anthony Stumbo, who's the regional chief medical officer for ARH facilities in Floyd County, wherein he has served in that role since 2004. He is also a UK graduate. So without further ado, we're just going to start launching into these questions, and hopefully we're going to address a lot of your questions for your businesses. So first, I'm going to throw the first question to Fadi, and that question is, COVID-19 is really no different than the seasonal flu, right? Why is it being treated so differently than the flu?
Thank you, Dr. Arnett. And again, the answers will be based on science, not on politics. And that's basically the message we're going to be very consistent with throughout all our answers. And you're right. The flu and COVID-19 are both contagious respiratory illnesses. They are transmitted mainly in a similar fashion. We call them the droplets. Some of them are small, some of them are large. And that's how you pass the infection, by talking, by singing, coughing, sneezing, especially in confined places with poor circulation and poor ventilation. However, there are several differences between these two illnesses, and I'm going to cover 4 of them. Number 1, COVID-19 incubation period, which is basically the time you need to become symptomatic, is a little bit longer than the flu, 5 days versus 2 days, and this will make a big difference as well in the way people are behaving and becoming symptomatic. Number 2, COVID-19 seems to be more contagious and transmissible, especially with the Delta variant. Initially, with the initial versions of the COVID-19, we were talking about R0 of 2 or 3. And I'm going to cover that very well, that during the Delta variant, we have seen an increase in the transmissibility. And we're talking now about a R0 of 8, which means if you get infected, that infected person can pass the infection to 8 more. And then these infected people will pass to 8 more each one. And here we're talking about exponential math. And I'm going to explain that very well. Let's suppose I have a lot of money and I want to give people 2 options, $1 million or 1 penny. And I will ask you, I want to multiply that penny by 8 every day from the amount that you had the day before. And we look for 10 days. You make over $1.3 million at day number 10 versus the $1 million that you can get up front. And that's the paradox about COVID-19. The increase is so exponential, and you go into a paradoxical phase with vertical increase in the phase and surge. And this is what we have seen in other countries. In UK and India, when they have the peak increasing in no time because of the Delta variant is spreading so fast and it's very contagious, and in fact, even younger people. The third difference is people coming to the hospital with COVID-19 are currently sicker. So COVID-19 doesn't behave the same way like the flu. There are several clinical manifestations and platforms for the COVID-19 totally different from the flu. This is an immunological disease by excellence. Once you finish the viral illness, you're going to face complications like clot, heart problems, neurological manifestations, in addition to long hauler manifestations, people having like fogginess of the brain, neurological symptoms, respiratory distress for a long time. So these symptoms are totally different from the flu. And that's why we say, yes, there are the same illnesses when it comes to respiratory illnesses. However, the spectrum and the behavior is totally different. In addition, that mortality from COVID-19 is way higher than the flu, 2 to 3% versus 0.2% for the flu.
Well, Fadi, that's a great answer about why this is so different from the flu and why we have to treat it very differently. So our next question is, to Jim Borders. What is the Delta variant and why are we so concerned about it? We've heard a little bit about it, but can you expand on Fadi's answer a bit?
Yes, Dr. Akros did mention that the Delta variant is different. It is, as by the way, these variants represent mutations that invariably occur in viruses that are widely spread through the community. Viruses have a natural mutation tendency to survive, and as they're propagated, they mutate into other forms, and sometimes more virulent forms, more harmful forms, ones more readily able to escape vaccination and treatment methods. These variants are labeled by the Greek alphabet. The alpha variant, for example, was first identified in the United Kingdom, the beta from South Africa, and the gamma in Japan and Brazil. But what seems to distinguish the Delta variant, as Dr. Akros has mentioned, is that this particular variant is as contagious, as some have said, as chickenpox. Previously, we took some comfort in the fact that the contagiousness was not felt to be to the degree that it is now, but one of our local infectious disease experts, for example, said that it is so contagious that he's gone on the local media to point out that either you get vaccinated or you will become infected with Delta variant in the not too distant future. And so ultimately, it's a choice between one outcome versus the other. Many times people choose not to be vaccinated as if the alternative is to carry no risk, but we do not live in a COVID-free culture. For anyone who goes out into community, they're accepting one form of risk or another. And so our message remains that we choose vaccination. The Delta variant probably is thought to consist of 97% of local cases of the coronavirus currently. And so it's extremely contagious. And with schools starting, opening up, some of which have been fairly lax on some of the distancing rules and so forth, that's what really concerns us.
Thank you, Dr. Borders. And there are lots of questions in the chat, and we are going to get to them throughout this morning, so keep them coming. Dr. Stumbo, you've heard a lot about infectious nature of this Delta variant. Do you have anything to add to the two prior panelists in terms of infectivity of Delta?
Yes, ma'am. Thank you, Dr. Arnett, for the to be able to participate today. Dr. Fadi, Dr. Borders did a good job of discussing the Delta and discussing some of the reasons that it was more effective. From a pathophysiologic standpoint from the virus, there's two major reasons from a physiology standpoint that this virus is more effective. Number one is that the viral loads compared to the alpha variant or the first variant last year, the viral loads in the throat or in the posterior oropharynx are about 1,000 times greater than we were seeing. The second thing that makes this virus more infectious is that the virus adheres to the mucosa more. I read an article, they likened the alpha variant to be stuck with syrup, but that the Delta variant kind of stuck to the oropharynx like super glue or gorilla glue. So those two factors from a pathophysiological standpoint allow the virus to be more infectious. And it goes to, and Dr. Fadi did a good job of describing the R naught. And of course, the R naught is a mathematical expression that basically tells how much a microbe is infected. Anything less than one, the virus can probably be eliminated. If it's one, it will be with us for a long time. If it's greater than one, it can result in an epidemic, or in this case, a pandemic. And as Dr. Fadi correctly asserted, the rho value of the R with the subscript subscript of 0, the R naught, was around 2 and 2.5. With the Delta variants, 8. So it is an exponential growth. So that definitely plays a role in this. So, and again, these differences in adherence and viral load are related to the mutation of the spike protein that Dr. Borders discussed. So it is certainly more infectious than what we've seen, and it is very, very transmissible, and that's kind of where we're at. So that's I'll finish up with that.
So we've had questions in the chat function today about whether or not this Delta variant is still infectious if you've been vaccinated. And I know this is really a question that's really concerning to our community right now. So Dr. Sumbo, do you have any advice about Delta and vaccination?
Well, that kind of segues into one of the other questions I had discussed, but yeah, can vaccinated people get COVID-19? Yes, they certainly can. However, because of the vaccines, vaccines are still needed, obviously, because they will decrease the risk of infection 8-fold. They will decrease the risk of hospitalization by about 25-fold, and they will decrease the risk of death about 25-fold. And we here in Prestonsburg at Highlands Regional, we've got 38 patients with COVID here, and on an entire 13 hospital system in ARH, we have about 130 patients. 97% of those patients in our hospitals, almost 100% of those patients in our ICUs are unvaccinated. So the director of the CDC correctly labeled this pandemic of the unvaccinated several weeks ago. And I think that our numbers here locally and in our system reflects what's going on in other parts of Kentucky, the nation, and the world.
All right, so we have great questions in the chat. We're going to get to them. But for now, I'm going to go to Dr. Hester. And, Steve, we saw last year, post July 4th, there was a big surge. We've seen a big surge again now, even bigger with Delta. What can we expect for the fall? Is there going to be that Thanksgiving to Christmas surge that we saw last year?
Thanks, Dr. Arnett. I do think, first, I think we're in that 4th surge right now. And so I really look back. We really had the first in April of 2020, another in December or July of 2020, and then the 3rd in December of 2020. And we're really seeing a big pickup in a surge right now that's continuing to escalate. So, to tie on a little bit of what Dr. Stumbo mentioned, so we've got across Norton Healthcare, we have 170 inpatients with COVID. Of those 170 patients, 17 are vaccinated. Now, the important thing to highlight there is those 17 are 80. The average age of those 17 is 80. And really what that shows is, as you get older, you do have that waxing immunity. So you basically don't respond as well to some of the vaccines, but you get protection, but maybe not as much. But the amazing thing is the average age of the other unvaccinated admissions is 53. And those are individuals that clearly, if they were to get vaccinated, would not be hospitalized. And so the vaccine really does offer protection. As we go into the fall, and if we look at some of the previous spikes we've had, if we look at this one compared to December, sort of where we're escalating to, we may be in for this being, elevated for 2-3 months unless we see something rapidly change with vaccination or changes with the Delta. And so this continues to put, pressures on lots of things, not just the businesses we see in the community, but healthcare resources. And not only that, but this time we're seeing it a little different with children. Where the first time around with the Alpha variant, we would see kids get COVID, but not nearly as much. But now we're seeing the Delta variant with an increased number of hospitalizations for kids. It's still low compared to the adult side. And those children who are hospitalized tend to have comorbidities. So they have chronic conditions that put them more at risk. But certainly we need to see folks get vaccinated. And that's really what we're going to get to in terms of, as part of these discussions, That's the piece that's important. And so when you look, a couple things, when you look, I guess, at our ICU patients, in terms of the vaccinated patients, we rarely see a vaccinated patient who ends up on a ventilator. If they are, again, it's the extreme elderly who maybe not responded as well, and that, someone in the 90s with other comorbidities. And so, again, I just can't emphasize enough that the vaccine works. We're seeing great benefit from it in terms of this pandemic. It's a horrible situation, and we're likely to continue to see a surge if we can't start controlling that.
And we did have a specific question, Dr. Hester, about ICU. Are any of the ICU patients vaccinated?
Yeah, that's what I was saying. Mostly just, the majority, it's rare that we see patients who are vaccinated in the ICU. And again, if they are those extreme elderly with other comorbidities. And so it's not a common place to find someone vaccinated in the ICU. Or on a ventilator. That's the key piece. When you look at the vaccine, what it's doing, one of the challenges on the vaccine is everybody wants complete immunity. And, the thing is, you're looking for protection. And what the vaccine's offering is the protection from hospitalization and death, which are important endpoints when you look at a disease.
That's a great point, and actually how the vaccine trials were designed to prevent death and hospitalization. So great to hear. Now, there's a lot of concern right now about kids going back to school, and there's been a myth that kids are resistant to COVID-19. So, Dr. Alacross, what do you have to say about that myth?
So for kids, that's a good question, because I take the analogy all the time when I talk about the kids. So people, they argue with me, last year we didn't have any case of infection in children, and currently we see spike, as you mentioned earlier, 25% of the cases positive in our state are in kids. And I take that analogy all the time. You don't get wet on a rainy day if you stay home. And this is what happened last year. We shelter our kids at home, and that's why we don't see these cases happening and circulating. Currently, these kids are fully involved and engaged in physical activities. They are in close contact in sports. They go into school. And you can tell that these numbers are growing. And what's really bothering me now, because we're seeing kids coming to the hospital because of severe disease. And this is something we did not see with the Alpha variant and the other versions of the COVID-19. So several observations as well that the Delta variant is affecting kids and infecting more people. And my biggest concern, if you look at the statistics in Kentucky, especially in the rural area of Eastern Kentucky, that a big percentage of these kids are basically raised by old folks, by grandparents. And this is really my biggest concern. Most of the time they are not vaccinated, and these kids are gonna do well. Most of the time they're gonna do well. They can have a little bit of sniffle, a little bit of fever for a day or so, but they're gonna overcome these problems easily. But the problem, if you bring the infection home and these vulnerable ones are contracting the infection, this is becoming a major issue, because these old folks are going to end in the hospital suffering the complications of COVID-19. The problem now is the Pfizer vaccine is approved or emergency use authorized for 12 and older. And I believe the results of the studies for Pfizer and Moderna will be released very shortly, I think in September. And we're expecting then authorization for these vaccines for 5 and 12 will be released in probably early winter. And I believe at that point, you'll be able to take away a lot of worries out of the plate and comfort parents, because currently they're not able to vaccinate their children. But yeah, we are seeing more problem in kids. We are seeing intersection with RSV, which is very unusual to see them in the summertime. And this is also bothering me as well. And that's why we're pushing for mitigation measure in school. I don't know if the 3 feet is enough as well with the Delta variant, because in the past we pushed for the 3 feet between each kid. Now, I don't know if this is basically the best way, or we have to go back again to the 6 feet, but I believe that kids, they should go to school while we are pushing for mitigation measures and make sure that the season is done perfectly well without glitch.
So just to clarify for our lay people in the audience, what is RSV? And what are mitigation measures, just to be clear?
RSV is one of the viruses that can cause severe respiratory illness, called respiratory syncytial virus, which can cause severe bronchospasm and pneumonitis in kids, and they can end in the hospital. And this is something we see most of the time in the wintertime. And currently we see it in the hot weather, and this is very unusual. So that's basically what we're talking about. And that's why we see more hospitalization for kids currently occurring across several states. Now, mitigation measure, I mean by mitigation measures, which is something that we used to use all the time with vaccination. So vaccination and mitigation measures are complementary until we reach what's called herd immunity, 70% and more. Because at that point, we will build what's called an immunity wall around the vaccinees, and we'll be able to cut down on the surge of the infection. And these mitigation measures are masking, proper masking, social distancing, hand hygiene, ventilation. Is very important to talk about the aerosol aspects, especially in confined places. When you go to confined places with poor ventilation, you increase your chances of having the infection. In crowded area, you need to have a proper ventilation. Open the window, make sure the AC are circulating the air, pushing the air outside very, very frequently. All these aspects are extremely important to cut down on the risk of transmission. As Dr. Stambo said, now with the Delta variant, we see a remarkable increase in the viral load. These particles are multiplying so much in our mucosa, in our inlying, and that's why we see more transmission and more infectivity, because anytime we talk about infection, we're talking about infectious load, which is around 1,000. And this is so easy to do it with the Delta variant. So we need to keep for mitigation measures with masking, social distancing, hand hygiene, along with the vaccination until we get the 70% and more of herd immunity. And to be honest with you, you have two ways to get herd immunity, either by vaccination or by natural immunity. Vaccination is predictable and safer. Natural immunity is unpredictable and is harmful. It is so disturbing for us to know who's going to end on mechanical ventilation. Could be a young person, could be a kid, could be anybody. While the side effects, mainly the serious side effects of vaccines, are extremely low. If you look at the verse on the CDC website, 2 to 5 per million will have anaphylaxis. There are 5 to 7 thrombosis, thrombocytopenia syndrome for Johnson & Johnson. We're talking about extremely rare complications from vaccine, and this is definitely a small toll to pay compared to the magnitude of complications of the disease by itself.
Great question and answer. I'd like to sort of pivot because we have so many businesses here represented today. What can we expect with kids and schools as the fall semester progresses? Mass closings, what do we do with people who are quarantined? How do businesses adapt to all of these changes for their workers who have kids in school? Dr. Borders, what do you think?
Well, I think it is a concern, partly because I think the easing of the restrictions that were considered so logical just a number of weeks ago would probably never have been allowed were the current circumstances in play. But there's certainly a lot of resistance. Personally, I think a fair amount of denial and a lot of defiance of politically going backward in many of the restrictive measures that Governor Beshear has been countered with from conservative political forces. But I do think the fact that the students are highly engaged with each other, and there's such an attempt to go back to business as usual. Given the contagiousness of this virus, I do think that businesses need to be prepared for the amount of and exposure to adults. When children are together, as Dr. Akras has mentioned, they themselves are probably not at much risk. In fact, to my understanding, nationwide, about 350 children have died of COVID. But one consideration that is often forgotten is this long COVID that you hear about, these symptoms of fatigue, mental fog, respiratory symptoms. There was a study in the United Kingdom that about 14% of children there had symptoms for several months. It is not what flu and colds will do. It doesn't just come and go. And we don't really understand the long-term effects of what COVID represents. And that's actually one of the counter arguments to those who are afraid of the so-called long-term effects of the vaccine. Yes, and perhaps this answers another question, and that is that, why is the FDA still not giving final approval? Well, some of that requires time. We have certainly a lot of numbers, but there still is a fairly short amount of time that the vaccine has been out. And so they have rules about the amount of time that they need to observe any new treatment before giving it final approval. But one thing for certain is if there's concern about the long-term effects of the vaccine, we have to be also aware of what are the long-term effects of COVID. My own daughter, who's 31, had COVID in February and is still struggling with some symptoms. She's a perfectly healthy person otherwise, and does not understand why she's so fatigued and why she has trouble concentrating at times. And I think in the long run, we will be dealing far more with concern as to those who had COVID, thought they had recovery, and who knows that down the line, we may find that they carry with them some long-term health effect that research in the days, weeks, months, years from now may fully uncover. So, but yes, back to the question of what businesses can expect, I do think that there will be quarantines, there'll be school exposures. We know of school districts in Texas, for example, that have had so much infection, they've had to close down. And we realize that childcare elements can be very disruptive for families and businesses. So I think most businesses need to be braced for this as school is starting back.
Well, it's looking like Dr. Arnett has lost connection. Give us just a second. I'm going to do my best to get her back on here.
Kyle, this is Ashley. Am I popping up on the screen? I can kind of take over and ask some questions.
Sure.
Okay, we're going to go ahead. Often in 2020 and 2021, we often have technological problems, so we will just roll with it. I'm just going to go through some of the questions that have been put in the Q&A. One thing, and I don't think we've really probably covered this yet, but I know that I hear a lot about this from employees and friends and family members, is the issue with fertility in women, especially in younger women. And we know that we look at the vaccination rates, and we know that in those younger populations, the 20 to 30 and the 30 through 40, we really need to get those numbers up. And so can any of you all, and I'm sorry, I don't have kind of my notes in front of me, but if any one of you want to pop in and kind of talk about fertility and these vaccines. I know we've often read things on the internet, and so maybe debunk that a little bit, because I do think that's a big concern amongst people in that kind of 20 to 40 year age range.
So actually, I'm happy to start on that if somebody wants to jump in after. But right now, I mean, you're clearly seeing there's some research that came out recently that showed that if you're pregnant and develop COVID, you have a much higher risk of having complications during delivery. Some of those complications: preterm births, stillbirth, ICU admission for mom, complications of the infant. And so we're really finding that more and more that you're seeing, back to some of the comments that were just made earlier, that COVID really does create long-term complications for these pregnant moms. And so one of the important things is the American College of OBGYNs has come out really with a strong statement to recommend that all mothers be vaccinated. And so there have been studies looking at any complications that might be happening with a mom who's had the vaccine, nothing related to breastfeeding in terms of concerns from that perspective. And so there has been a lot of information that's out there. Now, again, if someone wants to say we don't have 10 years of data on this, they're correct, we don't. But at the same time, we don't have 10 years of data of knowing what the long-term effects are on patients, but we do know that during delivery, there are significant risks. And so if you're a pregnant mom, it really is important to make sure you're getting vaccinated. We also know that we have a history of vaccines, a long history of vaccines, and we understand sort of what types of vaccines create problems during pregnancy and, safety around those. And again, this is really important for patients to make sure they're approaching that if they're concerned. And there really is no data to show that there are fertility issues related to the COVID vaccine.
And Dr. Hester, was my understanding that this started from some disinformation that has spread on the internet regarding some parallels between what we've referred to as the spike protein that the vaccines target. There's also a spike protein on the placenta, and that, I think, started the rumor that there could be some effect on fertility. But as mentioned, there's been absolutely no evidence so far that there's any adverse effect on women throughout their reproductive years, whether they're breastfeeding, pregnant, or considering pregnancy. And as already mentioned, all of the major women's OB groups have formally encouraged women in all phases of reproduction to get vaccinated.
I'm going to add also on male, because we're covering the female fertility. And let me cover also the male fertility, because there've been study on the sperm quality and quantity before and after vaccine. There's no impact on the sperm. So which means that the vaccine does not have any major impact on fertility for male. However, we have studies showing that the disease by itself might cause infertility the same way like Zika virus can cause for male. So we need definitely to take away the myth and send the right information. And all the societies, including CDC, including the American College for OBGYN, every society recommending the vaccine for pregnant women. Last week, I had 3 pregnant women in the hospital. And as Dr. Hester said, that there is a 3-fold increase in hospitalization, complication, and premature delivery. One of them was an ECMO for many days, and she was successfully discharged. It was a great history. But these people can definitely suffer the drastic consequences of COVID-19, and we don't want to see that. On the top of that, the vaccine will protect the baby because of the vertical immunity. So we need also to cover the baby as well, because I have one of the baby currently in the NICU. So here you have to think about the mother as well as the baby and what's safe for them. We have done vaccination for women for many years. I know we don't have long-term data, but the data that we have now is very reassuring.
So that's good.
I would just like to make a comment, please, if you don't mind. And I agree with all the panelists. But one thing is, in medicine, and the physicians know this, but also in life, we have to make decisions based on risk and benefit, okay? If I elect to either choose to treat a patient or not, I evaluate the risks and benefits. In life, I could choose not to pay my taxes and I would have more money. That would be the benefit, but the risk is I'll be in jail. So while we don't know what the long-term effects are, we do know what the short-term effects of COVID are. And they are a lot more scary in my mind, and people should be much more aware of those. So when I talk to people about vaccinations, I always want to bring in that risk-benefit ratio. There are certain risks involved, but the benefits in my mind far outweigh that for pregnant people or for non-pregnant people, but just for the entire population.
That's great. And I think that that's an important point to kind of make sure that is understood. If you are pregnant or planning to get pregnant, it is still very important to get the vaccine. I think that's been made clear by all of you all and all the medical professionals that have weighed in on it. One question, Fadi, I'll go to you, is what are the side effects of vaccination? Obviously, I mean, I had the Moderna vaccine many months ago at this point, a couple of days of almost flu-like symptoms, a sore arm, but we also hear about blood clots, and especially in the summer when the J&J shot, where it was kind of paused for about a week or so because of some of the blood clots in younger adults. Talk a little bit about the side effects of the vaccinations and maybe ease some people's minds about these side effects.
So the side effect of the authorized COVID-19 vaccines that we have in the United States are almost the same compared to other vaccines. So you have a needle injection in the muscle that can cause some sort of soreness. You can see some sort of inflammation around the injection site. You may see fevers, chills, some GI symptoms. And all these signs are absolutely healthy findings, because what you're doing here, you're creating fighters in your body. So this vaccine is generating what's called antigenic proteins called S-spike, making the immune system recognizing that and start to develop immunity. And here immunity has two forms. You have the humoral or antibody immunity, in addition to the cellular immunity. And that's why we sometimes see some lymph node at the site of the injection, because this is where these cells will go to create what's called memory cells, B cells, and T cells. So all these side effects are completely normal findings anytime you take the vaccine. They are healthy findings to say, yeah, your body is responding to the vaccine and basically preparing the body to fight the fight if you contract the COVID-19. Now, sometimes we see rare findings like anaphylaxis, but I just covered that. Anaphylaxis is extremely rare finding that we see with the messenger RNA. Some people, they have allergy to polysorbate or polyethylene glycol or certain food. They may basically cross-react with the component of the messenger RNA, because the messenger RNA is covered by a lipid droplet, and that lipid droplet, to protect the messenger RNA from being degraded in the system, and serves as a vehicle of the vaccine to latch on the muscular cell to release the messenger RNA inside the cell. So that's the role of these basically vehicle, is to send the messenger RNA to the cell without being damaged by our immune system. If you look at the J&J, majority of these side effects are mainly in certain age group, 20 or 18 to 49, mainly female. And most of the time they have some sort of autoimmune underlying disorder. But if you look at the number, thrombosis, thrombocytopenia syndrome, or thrombosis of the sinus venous system in the brain, 7 per 1 million. So we're talking about extremely low incidence of complications. And as Dr. Stambo said, anytime we do any medical intervention, we weigh the benefit and the risk. If your risk is way high to have complication from COVID-19 infection or natural infection versus the vaccine, then definitely vaccine is the best option. And I believe this is the quickest and the safest path to normalcy. So that's my opinion on that.
Great, thank you. And we will
Yes,
welcome Donna back. Technological problems are a thing that we are used to around here, especially in the days of Zoom. So I will stay on just in case that Donna gets kicked off again, but I will turn back moderating duties over to her.
I apologize. It's just technical difficulties here. All right. So when do you think we'll have the ability to vaccinate the kids under 12? We've kind of covered that a little bit in the already, but Dr. Borders, do you have any ideas about that?
Well, I understand that more than 100 members of Congress, led by 2 California representatives, have sent a letter to the FDA just this past Tuesday asking that very question. And they've requested a briefing by FDA Commissioner Dr. Janet Woodcock within the next 10 days. She's been given 10 days to respond. The American Academy of Pediatrics sent a similar letter to Dr. Woodcock on August 5th, urging approval as soon as possible. And I understand that the FDA has asked Moderna and Pfizer to double the number of children ages 5 to 11 in their safety and efficiency studies. Pfizer plans to submit an emergency use authorization request for the 5 to 11 age group in just about 3 weeks, and for children as young as 6 months to 5 years, supposedly shortly after that. I do have to mention for balance that just 2 months ago, the majority of parents of those between the ages of 3 and 11, according to one large survey, said they would not want their children vaccinated. So again, a lot of vaccine hesitancy in the parents of children that young. But to answer the question, we may have something akin to the adult version of the EUA, the Emergency Use Authorization, within the next 3 to 4 weeks.
Well, that's great to hear. We certainly need them to move quickly on that. So I know that people in the chat have talked about vaccination side effects and the concerns about all of that. And we heard, most recently about cardiac inflammation and young boys and young men who had the vaccine. What can you tell us about that inflammation, and is it something we need to worry about? Dr. Stumbo.
Yes, Dr. Arnett. That's physicians tend to worry. So we always worry about everything, seems like, but there's different degrees of worry. There have been some rare reported side effects of inflammatory cardiac disease in children or young adults, males, usually after the second dose of one of the vaccines. But the latest CDC numbers show that the incidence of that is about 40 per million. So just do the quick math in your head. That would be 4 per 100,000. That would be 1 in 25,000. So it is there, but it is very rare. The odds or the probability of being struck by lightning is about 1 in 15,000. And that's in an 80-year-old or 80-year lifespan. So the rate of myocarditis or pericarditis in these individuals is 1 in 25,000. Now, some of those numbers vary. Some people say it's 20 cases per million doses, and some people say it's 60, but the CDC's kind of split the middle and said 40. But again, you're more than likely to get hit by lightning twice in your life, as opposed to having myocarditis or pericarditis related to this vaccine. So is there a worry? Yes. I think clinicians need to be aware of the symptoms. And another thing that we always have to remember is, I've been practicing internal medicine for 32 years. Common things are still common. There were people with pericarditis and myocarditis prior to COVID, prior to the vaccine, and there will be episodes of pericarditis and myocarditis after COVID and after the vaccine. So there is a temporal relationship. Most of the cases that the CDC were aware occurred within 3 to 5 days of vaccination. So there is a temporal relationship, but as we all know, a temporal relationship does not always indicate causality. So we certainly, it has been concerning, but am I overly worried about it? No more than being struck by lightning today.
And I think it also needs to be said, to butt in, that these cardiac inflammations are very mild and they're self-limiting. They do not require really any treatment. So it fades off much like a muscle soreness, which really is what myocarditis is, a muscle inflammation that resolves on its own with no apparent lasting effect on the function of the heart in the years to come.
Yeah, Dr. Borders, I agree. There has been no deaths that have been attributed to that myocarditis. The mean hospitalization, not just a fraction of these people were hospitalized, but the mean duration of hospitalization has only been about 2 days. So it is, as you're exactly right, it is mild, self-limiting, and has not resulted in any deaths that at least I'm aware of at this point.
So we talk all the time about myocarditis, pericarditis from vaccine, and nobody touching on the myocarditis, pericarditis from COVID-19.
Right.
So I want to basically send a clear picture to the public that several studies showing now that 50%, there was one study in athlete, 50% of them, even although they have mild to moderate symptoms, develop myocarditis from the natural disease. And there is also larger study showing that 20-30% having active myocarditis after active infection with COVID. So the numbers of myocarditis, pericarditis from vaccination is still anecdotal. However, we have a solid data and solid evidence that COVID-19 can definitely cause inflammation to the myocardium by 2 ways: directly by the ACE2 receptor causing direct inflammatory process of the muscles, and the second one through the systemic disease, especially people admitted to the hospital, because you're creating basically thrombosis And after thrombosis, you can cause some sort of ischemic event to the myocardium. So the risk of myocarditis, pericarditis from the disease by itself is way, way higher than the possibility after vaccination.
And I think that same parallel must be mentioned regarding the blood clotting risk with vaccination. You hear that, and that gets quite a bit of play, really more for the European AstraZeneca vaccine than any of the ones available in the United States. But nevertheless, there is a very slight, I think it's roughly 4 in a million, it's less than 10 per million clots per million vaccinations. But with natural COVID, blood clotting is such a prevalent problem that it is a routine part of the treatment for hospitalized patients to receive special anticoagulation. It is a source of tremendous morbidity with the COVID infection. In fact, our first patient at Baptist Health Lexington came in with a stroke. And we, at the time, attributed the stroke as something quite different than his COVID infection, and only to learn very shortly thereafter that stroke very likely was a part of the COVID infection spectrum. So most certainly, if those who are afraid of getting vaccinated for fear of a blood clot, that risk is drastically greater with natural COVID infection.
Yeah, I agree,
right.
Dr. Borders. We use enoxaparin or Lovenox as one of our probably 3 or 4 pillars of treatment in the inpatient setting. And it has been shown to help decrease those thromboembolic events. And it is something that we do have in our order sets. And unless there's a contraindication, patients will get those. So that's a very good point, I think.
And just to follow up on the cardiac inflammation that happens, it really is a product of the infection itself. It's not a pre-existing condition. It really happens from the infection. Well, let's move on to our next question. And I think this is a one that a lot of people struggle with. If you've been vaccinated and you've had your second vaccination, why do you have to wear a mask? It's one of those irritating things that people live with, but why is it so important? So Dr. Hester, what do you think?
Sure. I think one of the things we continue to learn more and more. I mean, obviously early on, we saw the value of masking. And just to give you a simple piece of that, every year we have a flu season. Flu is not nearly as contagious as we're seeing with the Delta variant now, but just to give you a comparison, when we were all masking, we didn't have a flu season last year. Now, I'm not recommending in any way that we mask forever to prevent flu, but what I'm saying is there's a point that the masks work. And so we see that it can really help prevent contagiousness. And especially when we're dealing with the Delta variant we are now, where we're seeing it, spread so easily, it's important to wear the mask. So if you're vaccinated, one of the things we found with the Alpha variant was if you were vaccinated, you weren't likely to catch that and spread it. With the Delta variant, if you're vaccinated, you have a higher chance of being able to spread it. And so while your symptoms are likely to be milder, again, lower your risk of hospitalization, lower your risk of death, you have a potential to be spreading that. And so what we want to make sure of is by wearing that mask, what you're doing is helping protect others. Now, the hope would be that we all get vaccinated and then we're there, we won't have this issue. But, specifically too, when you're looking at a population that's not been able to be vaccinated, those kids that are 12 and under, that's the real opportunity. I mean, wearing a mask really protects that population because even if you've been vaccinated, you have a chance to spread it to young kids. And it really is important. So, I look at that as, while it is an inconvenience, we're in the midst of a pandemic. And you look back through history, certainly our families and grandparents have had really hard times of things before. And, this is just one of those times where we're going to have some challenges. And to really get control of this, we're going to need to be vaccinated, and masking is going to help in this process.
I think it's really important to understand that the virus, when you're infected, really lands in your nostrils and the back of your throat. And, you know, there's IgA, IgG, you know, that immune response that we have. And we can have infection in our nose and really vaccinated never really get an infection. So I don't know if anyone wants to comment on that, because there's this assumption that you can't spread it if you've been vaccinated. And because of the way the virus settles in our system, that's just not true. Does anyone want to comment on the science behind that?
Yeah, can I jump on that just quickly? Because I think we have misconception about what the vaccine is supposed to do. And I think this is the biggest misconception currently running in the United States and in the world. The vaccine is not perfect, and we cannot let the perfect be the enemy of the good, especially when the... Can you hear me?
Yes.
Yeah, okay. So the vaccine is not perfect, and we cannot let the perfect be the enemy of the good, especially when the good is outstanding and achieving the goals. And what are the goals of vaccine? The vaccine is supposed to prevent severe disease and hospitalization. The number of COVID cases by itself is not important. I need these people to be protected and have the fighters in their body to be able to prevent the drastic outcomes of COVID. This is what's important. So extra case there and extra case there is not gonna make any big difference. And I think this is basically the misconception about the vaccine. We want it to be perfect, and it's not gonna happen. And the other thing, that COVID-19 is not gonna be eradicated. Let's be honest with that. The only way we can do is we can tame the virus, and taming the virus will take a lot of efforts to do that. And vaccination is absolutely an amazing tool to curtail that pandemic. So amid the COVID-19, especially the Delta variant, we have high viral load in the nostrils, in the mucosa. And it's been studied recently. I think there's one study in Singapore talking about vaccinated people are able to clear these viruses quicker compared to unvaccinated people. And nobody knows exactly if these vaccinated people are dealing with debris or the live virus. But because of abundance of caution, we consider masking for vaccinated people to prevent shedding the virus in the environment, and subsequently prevent somebody who's not vaccinated from contracting the infection and being sick and suffering the consequences of the COVID-19. So that process is so dynamic and fluid. And anytime we come with a policy, and that's why you see the CDC tweaking policies, because all based on emergence of new data. Not because we didn't know or we don't know, it's because the data has changed every day. And that's why we change the policies on a daily basis. So this is a learning curve. We learn every day. So we shouldn't be judged based on that. Whatever the CDC they're doing is to protect the public and to find the best ways to protect the public and stop the spread of infection.
Great point. So I know that previously we've talked about some of the myths about the vaccine itself. And one of them that I've heard a lot is the vaccine can come in and change your DNA. And we absolutely know scientifically that's not possible. But Fadi, would you go into more detail about actually, again, how the vaccine works and how it doesn't go in and alter your DNA?
Absolutely, and this is absolutely a great question, and we need the public to understand the process of the vaccination as well as the composition with the content of the vaccine. So all authorized vaccines do not contain any aborted cells and do not change the DNA. Let's be clear with that. And especially when I'm talking about the messenger RNA vaccine, Pfizer's and Moderna. And I'm gonna explain the process from pathophysiological standpoint. You have a piece of the mRNA. You don't have any live virus. You have a piece of the messenger RNA wrapped with a lipid droplet. You push it in the arm, and that lipid droplet will be a vehicle of the vaccine to latch on the muscular cell, and then we'll release it inside the cell. So that messenger RNA, just to make it very simplistic for the audience, is a Snapchat, and everybody knows the Snapchat. So this is something won't last long time, probably a day or so. And that messenger RNA will give information for the ribosomes to produce the spike proteins. And the spike proteins will be expelled into our system, training our immune system to be able to produce the immune fighters. So these how the vaccines will work. The messenger RNA doesn't go to the nucleus, doesn't get in touch with the DNA. And we have to be very, very clear with that. And I have information from last year that the virus can do that, not the vaccine. If you look at some of the studies from last year, in certain circumstances, the virus can be transformed to a DNA virus. And this is how sometimes it can escape the immune system. It can go to the nucleus, can cause long hauler syndrome, and it can cause also long-term shedding. So the virus can do that in certain studies in the past, but not the vaccine. So the vaccine does not modify the DNA, and it's very safe to our bodies.
Thank you, Fadi. I know that you have already addressed fertility questions related to the vaccine, but they keep coming up, and some of the in the chat. And just so you know, we're capturing the chat. If we don't get to answer all the questions today, we'll review them to see if there are common themes that we could work on to address for you. But the question is, if it's not recommended that young children be vaccinated, how can we recommend that women be vaccinated and the baby is protected? So Dr. Borders, do you want to talk again about fertility, about changes in the possible fertility of women, about pregnancy? Let's just cover that once again.
I've been muted. I'm sorry. I alluded to the fact earlier that there had been some discussion on the internet with regard to the spike protein of the placenta possibly being mistakenly targeted by antibodies created through the vaccine. It's a good example of what has been referred to as the disease of disinformation on the internet. There's been research actually looking at the reliability of medical information one is able to procure from the internet if you just Google any medical topic, and the reliability of the information obtained is less than 40%. I noticed on a chat that someone asked earlier, how did generations long ago accept earlier vaccines for polio, tetanus, and so forth? Well, I think we all understand that we live in a time of skepticism, but I truly believe that a lot of that comes from social media and the internet, where people who are misinformed are able to articulate their beliefs, and some people unfortunately cannot discriminate the validity of the things they're reading on the internet. And I think this concern about the fertility is a good example. There's been absolutely no evidence, no science, nothing whatsoever to support that. And as Dr. Akaras has mentioned, I think as well as the rest of us, we cannot live in a COVID-free world. Some people who say, I don't want the vaccine because of some theoretical concern that may come down from the world. Well, the problem is, unless you live in a hermetically sealed environment and have no interaction with the community, you are accepting all of the unknowns that come with COVID, which as a result of the Delta variant is here to infect you almost with certainty in the weeks and months ahead if you're out in the community and are not vaccinated. So you have to pick your poison. But there's almost no comparison to the safety of the vaccine when compared to the realities and I might say the unknowns of the COVID-19 infection.
It looks like Donna may have had some technical difficulties again, so I'm going to hop in. This is an interesting question that, of course, all of us know is false, but it is out there quite a bit on the internet. And Dr. Stumbo, I'm going to pitch it to you, and anyone else can feel free to jump in. Do the vaccines contain microchips?
Well, as you stated, Ashley, we all know that is false. And to tag along what Dr. Borders said a little bit, I think that this is a function, it's a conspiracy theory that is a function of the presence of social media. I like to say during some of our meetings here is that if there was as much information or social media existed in the late 50s when Jonas Salk invented or developed the polio vaccine, that we would still be seeing patients with iron lungs and assist devices to walk. Social media is a tool like anything else. It can be used correctly for good, but it can also be used incorrectly and bring some of these misconceptions and this mistrust that we're seeing. You know, an electric saw is a good tool, but if you use it improperly, you know, you can lose some fingers. And unfortunately, with this misinformation we're getting against, you know, these conspiracy theories about, you know, the microchips are in the vaccine as part of a governmental threat or a threat from Bill Gates or a threat from reptilian aliens. You know, it's mind control and tracking. You know, and I would bet and guess that some of the people that are saying these and spreading these rumors on social media, you know, have they ever thought that their smartphone is tracking them or recording their conversation? I mean, how many times have we been talking and Siri is always listening in the background? And, you know, me and my wife were talking about a vacation and, you know, I opened my phone up again and there's a hotel for the same location that we were just discussing. So, you know, it's kind of disingenuous for these people to think that we're not being tracked. I don't see anybody revolting against their cell phone like they're revolting against vaccination. So I think this is one of the most absurd, you know, stances on the internet. It is a direct result of misinformation on social media, and it's just absurd. So,
you know, actually, if I could just add one thing on that, you know, I think one of the things that we're challenged with is sort of some hyper focus on this right now specifically. And when you look at the amount of data, hundreds of millions of people have received a vaccine across the world. And when you look at that, the amount of data that goes in for this is just incredible. And when you look at it from what we do in our daily lives, the things we submit to, which have little to no data, is pretty amazing. And so, I mean, just thinking about processed foods, products that you use every day, whether it's, you know, personal hygiene products or whatever it might be, and the testing that goes into those, long-term effects of those types of things. I mean, all the stuff that we do that really we even know. I mean, let's take alcohol and tobacco as examples. We know long-term risks of those, and we know that people continue to use those. And so those are choices people make. But when you look at where we are in this pandemic from a conspiracy standpoint, you do see lots of people that have come up with alternative theories on this, but there is just an incredible amount of data. And I think something that we said earlier is nothing we do is 100% perfect. And so there is some associated risks, but the challenge is we're in the midst of a pandemic. And I can tell you that right now, the 170 people we have in the hospital and the 30 on the vent aren't feeling very perfect either. And so I think we've got to figure out how we tackle this as just a humanity side of things, because otherwise we're going to see a lot of things deteriorate. Because somebody did ask a question about what happens if the vaccine's resistant to COVID. Well, that's the challenge, is we're trying to get ahead of that, because every time it mutates, the virus is trying to survive. We want to get rid of the virus, and that's what it continues to do. And so the more people we can get vaccinated, the less mutations we'll see in that long term.
Can I add on that very quickly? And I want to give you a very simplistic picture about the microchip and about the vaccine. If anybody knows that these vaccines, they come in multi-dose vials, they're not individual. So we're not talking about individual vaccine, especially for the Pfizer and Moderna, 6 and 10. So how we determine which person will get the microchip from these vials then? Correct? So somebody will take 10 and somebody will take 1. So this is absolutely absurd to think this way. And number two, I've never heard about soluble microchip. This doesn't work this way. So there's definitely a lot of myth behind that. And we need definitely to send to the public a very clear picture that this possibility is very unlikely and doesn't exist, in fact. And Dr. Stumbo is right. You can be tracked by your cell phone way more than being tracked by a vaccine. Number two, I totally agree with Dr. Hester that the longer we keep that virus circulating in the community, the higher will be chance of emergence of variants of concern. And I'm going to basically address that to your esteemed audience talking about the virus. The RNA virus, the job of the RNA virus is to modify and multiply and mutate. It's like a stem, like a tree with stem, branches, and that's basically how they survive. This is how they fit the resistance. So the longer we keep that virus circulating and feed them with the opportunity to multiply and jump from one person to another person, the higher we create that opportunity for them to develop resistance. So these variants of resistance, the variants of concerns, are the result of our resistance and skepticism to take the vaccine. So that problem will be completely wiped off and swept up completely out of the picture if we do vaccination in timely manner and take our precautions very carefully. So if you don't want to hear about the variants, take your shot. This is going to be the best solution to stop hearing about these variants.
I would agree with that, Dr. Fadi. I would just like to add that the unvaccinated are actually incubators for these variants. And I am very concerned that we're only one or two mutations away from rendering our current vaccines totally ineffective. And we've heard about the Lambda variant there that is expressing the new one on the horizon, going by the Greek alphabet. But you know, there is some concern about that it is going to have more resistance to our current vaccines. And even though that the Delta variant is so transmissible, some of the best data after a 2-dose of Pfizer, you still convey 88% immunity. So I think that the big point is that we do have to realize that the unvaccinated could be, or not could be, are incubators of further development of variants. And that's scary to me.
And I will talk even about something else. Like people, they think also if they had a natural infection in the past, they protected from the Delta variant. This is not true. There was recently a study done in our state, in Kentucky, released by the CDC, I think a couple of weeks ago, in the morbidity mortality weekly report, telling us that people who previously infected, they have 2.3-fold higher chance of infection, reinfection, compared to fully vaccinated people. And this is also another message to the public. If you got infected, there is no guarantees that your body is going to mount proper immunity. And that's why we ask the young folks, the previously infected, and anybody to get vaccinated to give optimal immunity. And you're absolutely right, Dr. Stumbo. Study in the New England Journal of Medicine telling us that the vaccine is continuing to hold high effectiveness against the Delta variant, 88% for fully vaccinated, but that number will drop to 30% for partially vaccinated. So here, if you want to be vaccinated, do it the right way and get your full series to be able to achieve that immunity. Currently, we see what's called waning immunity. And that's why if you hear the CDC and FDA talking about the booster.
We did have a question in the chat, and I think Dr. Alakas, you've really addressed it. And that question is, if I've had COVID, why do I need to be vaccinated? So you've said it. I wonder if any other panelists have anything to add.
No, just as Dr. Akaras had mentioned, yes, I had read that same study, 2.34 times protection for the vaccinated versus the unvaccinated who has recovered from COVID. There's also some rather curious research that some of the long haul COVID symptoms may actually dissipate after receiving vaccine. Not sure the scientific support for what's happening there, but But so anyone with lingering fatigue, brain fog, some of that shortness of breath may discover that getting vaccinated helps some of those symptoms. That's what some research would suggest.
I'm glad Dr. Arnett was able to bring that up, because I did want to ask kind of one last question before we get to kind of the final round robin that I have planned. There have been kind of changing guidelines, and this is a pandemic unlike anything we've ever seen. And so it's natural that things progress and stances change. And we hear a lot about, last year at one point they said masks don't work. Now masks work. A couple months ago, they were saying if you've had the virus, then wait a certain period of time before you get the vaccine. Can any of you address kind of these ever-changing guidelines? Because I do think that's part of maybe the frustration that people see, and maybe some of the reasons that they're not quite certain to get the vaccine yet, is that guidelines do tend to be changing in this ever-changing environment we're in.
I'd like to address that if you don't mind, Ashley. And again, it's kind of a lot of the panelists have hit upon this. For instance, let's just go with the boosters. 6 weeks ago, 2 months ago, the FDA and the CDC said that they did not think that anyone would need a booster vaccine. Last Friday, came out that yes, the vaccine, that boosters would be given to a certain set of population, maybe 3% of the total population, and there were 4 or 5 criteria that would make a patient eligible for a booster. If you were a recipient of an organ transplant, or if you were undergoing active chemotherapy, or if you were on a immunomodulating drug, a rheumatoid arthritis drug, or if you were on high dose chronic steroids, which a lot of our patients are. Now, just in the last couple of days, it's becoming more that, healthcare providers should probably get the booster, nursing home, long-term care patients, those types of things. The reason I think that these standards change, and I think Dr. Fadi alluded to that, is we're always learning. And this virus and this pandemic, we've been fighting it now since probably late February of last year in the United States. The vaccine's only been available since December, so approximately 9 months. And, this was a whole new ball game when coronavirus came on the scene. We had never seen it or dealt with it before. So we have to go by the data, and as the data is going to continuously evolve, and it may seem like that the CDC or the FDA or the World Health Organization are being wishy-washy, but a smart man, you have to go where the data leads you, and as physicians, as scientists, we have to trust the data and go there. So it's going to continue to change, and who knows what's tomorrow. There may be a new recommendation comes out, but we have to be able to interpret the data, act on the data in the best interests of our patients and our communities.
Yeah, I think some of the problem is that the medical layman public is being exposed like never before to the scientific method. I think to be scientists, we have to remain open-minded and transparent, and that's where Dr. Fauci has, for example, been so vilified. I think people don't understand that the science is emerging so quickly. There's so many people looking at this. There's so much different research going on, and any of us who practice medicine much time for much of a time of our lives have seen many things change over time. But this has been such an overwhelming worldwide situation involving so many people, so many researchers, so much data, that it's invariable that some of this information is going to change. And, we live in a time, of course, where politicians are held accountable for things they said 10, 20 years ago, and they can't get away from it. And, if scientists are held to that same standard, Lord help us. I think we have to be in this situation with regard to science, willing to go with the latest data with an apology that it may change and it likely is different from what they previously heard. But it's the best we can do. It's the best medicine has ever done.
I want to add something. As Darwin said, it is not the strongest of the species that survive, nor the most intelligent, but the more responsive to change. So that's basically what's important. All the policies are made based on emerging scientific data. So what we decided yesterday could be totally different from tomorrow. And again, this is a learning curve, and we need to do what's the best for the community at large. We have currently a data telling us that 20% of the positive COVID-19 cases are among vaccinated people. 15% of hospitalization are among vaccinated people. And that picture was totally different 2 months ago because we have several variables now. We have now, number one, what's called waning immunity, which means the immune system is going to decline with time. And this is normal. And that's what we do for the flu shot. We give a shot every year, although its effectiveness never been more than 70%, number one. Number two, we tweak the flu shot almost every year because we know the virus is changing. So why different about the COVID-19 vaccine then? So there's nothing different. It's the same concept. These viruses will modify, will change, and we need to find a way to stop them from causing damages. And that's why the CDC is now talking about the third booster and the FDA about the third booster, because there is emerging data telling us we're starting seeing decline in the protection from the vaccine, but doesn't mean the vaccine is not working. We need to boost that neutralizing antibodies in the body. And we have data telling us that these vaccines, although they work on the prior version, they continue to hold effectiveness against the Delta, but you need higher level of the antibodies to do the job. So nothing basically different, but there is some tweaking in the guideline that unfortunately the public is receiving as hesitation or lack of knowledge about what we're doing.
Great, thank you all. So we are wrapping up on time, but I do have one final question for all of you. If anyone listening has an employee, a friend, a loved one who is still hesitant to get the vaccine, what is one piece of advice you would give them to share? And I'll kick it to Dr. Borders first.
I think the most poignant remark is simply that we do not live in a COVID-free world. It's not a choice between the risk of a vaccine and the risk of life as it was prior to the pandemic. It is the vaccine versus the pandemic life and risk. And the statistics so far outweigh the benefits of vaccine that you have to make a choice. To not choose to take the vaccine is to choose to accept all that the unknowns of getting COVID infection. That's the main message I would give.
Great, Dr. Hester, how about going to you next?
Yeah, I think, and I'd echo some of the same things Dr. Borders said. I mean, it's unfortunate that we're in this situation, but I would say that when you look around, there's been so much loss of life, and you can look in the news every day and see someone in their 40s, 30s, 50s, 60s and up who die of COVID, and they're unvaccinated. And there are the rare cases that someone can point to that someone died who had a vaccine, and those happen as well. But there are also typically other reasons there. And I would just say that, I can also say that I've seen a number of media stories that show patients who are on a ventilator who basically are saying, I wish I'd gotten the vaccine. And so those are true life stories. Those are people who are suffering. And, the goal is, unfortunately, with this virus, we probably won't get back to where we were. It's going to be with us. It's going to be a recurring kind of thing. You don't get rid of a virus like this, but we've got to find some way to control it. And that's the best thing we can all do is get vaccinated.
Great, thank you. Dr. Stumbo, you want to go next?
Yes, Ashley. Again, I think my main recommendation would be to run, don't walk to the nearest place that you can get a vaccine. Again, I think it goes back to risk and benefits, like a lot of decisions in life, both professionally and personally. The risk of developing COVID vaccine is much greater than the risk, or developing COVID infection. The risk is much greater of developing severe illness related to COVID as compared to the risk of the vaccine. And I think that the benefit of the vaccine far outweighs the risk of the vaccine. And I think that all of healthcare providers and anyone that we should urge and give that message that you are going to be chance to be healthier and live a more full normal life with the vaccine as opposed to trying to deal with COVID.
Great, thank you.
It's gonna be me now.
It's up to you. Finish us out.
Okay, I believe this is the way I describe the situation of COVID-19. The COVID-19 is going to be a marathon. It's not going to be a sprint. So let's be clear with that. We have to have the endurance, and we need to make sure that we have our cart at the back of the horse, not in front of the horse. So the vaccine is going to be a great way to be able to take us to the safe place and to go to the finish line. And as I alluded earlier, the COVID-19 is going to linger for a long time, and nobody should believe that it's going to go away. We're going to have that problem for many years. And the best way to deal with the COVID is to tame that raging virus. And currently we have amazing tool to be able to defeat COVID-19 and prevent the emergence of these variants. Vaccines are extremely effective, and they are very safe compared to the natural disease by itself. And you guys, you need to discuss with your physicians. Discuss with your physicians that you trust for long years. These people took care of you and your parents for many years. You're trusting them on several decisions, including surgeries and interventions. You trusted them on other vaccine strategies. So what's the problem now? So please rely on scientific evidence and do not follow, unfortunately, the political string.
Thank you all so much. I cannot tell you how honored we were to have you here today to share this information. I know how busy all of you are, and the last year and a half, I'm sure, was something that you guys had probably never wished would happen in your career. And I know that yesterday, the governor proclaimed that next week is Healthcare Heroes Week. So on behalf of the Chamber and all the businesses of Kentucky, we just want to say thank you for being our healthcare heroes and really seeing us through this. Hopefully we will come out on the other side, and we just greatly appreciate you all sharing your knowledge and your information with all of us. I just want to say again that we will be sharing this recording. This entire thing has been recorded, and so we will share this far and wide, make that public. And so I think this is really important. I would just ask everyone watching, if you know someone, love someone, work with someone that has not been vaccinated, please share this recording with them to help maybe answer some of the questions they might have. And last but not least, I do want to give a plug for the Chamber's campaign, COVID Stops Here, which recognizes employers across the Commonwealth that have reached 70, 80, 90, and 100% of vaccination rates. And you can enter in that sweepstakes and get your employees registered to win some pretty cool prizes. We have concert tickets, we have tickets to the racetrack, we have bourbon, we have craft brewery tours. So make sure you check that out on our website, kychamber.com. Again, to all the doctors that participated today, thank you guys so much for taking time out to help with this webinar. And hopefully we'll get a couple people more vaccinated by sharing this information. We appreciate you guys spending a couple of hours with us on a Friday, I guess almost afternoon now. So have a great weekend, and please let us know if there's anything that we can do to help get you and your employees vaccinated, and we will talk to you all soon. Thank you.